Hi, I'm Jason Sean Bennett from the Exceptional Health Company. Let's talk a little bit about obesity and diabetes and the links that they have together and what we can actually do about them, and maybe what are the things that are causing them. If we look at obesity and diabetes, we start to notice things like obesity is now hitting around 30 to 31% of adults in New Zealand, Australia, Mexico, the UK, all over the world. So we've got a real problem with a lot of us getting far, far bigger than our body can sustain over time. So when we're looking at carrying weight and obesity, we start to look at what are the things that cause that, and is it going to be a problem for us long term? Now we do know that obesity over time causes real problems to your health. It raises your risk of 30 or 40 different cancers. It raises your risk of dying young of heart disease. It raises your risk of high blood pressure. It raises your risk of diabetes. It has a huge negative impact on your body. So what we want to do is look at what is causing that and what we can do about it. So we know that the obesity rates are out of control, and we know that this is such an epidemic that if it was anything else, we would be in a national panic about it. But because it's creeping slowly and it's raising every year, we don't tend to notice, we don't tend to treat it with the respect that it needs. So it's really important to get yourself into the kind of shape that you can sustain over time and get yourself into the right body shape for you, and that will vary for everybody. But it's really important that if you're carrying a lot of weight, to start to work on sustainable ways to get your weight down. And of course, we can help with that on my 20 Golden Weeks and on the Life Plan. And we start to look at what's going on around the world, and we notice that diabetes is being fueled, and we know that it's type 2 diabetes that's mostly growing. If we look around the turn of the century, we find that it was mostly type 1 diabetes, was around 90% of the diabetes. Whereas now, in the time we're living in, most of the diabetes in the world is type 2 diabetes. And we know that type 2 diabetes, or the more appropriate name, adult onset diabetes, which is actually the correct name, which is something that used to only hit in adulthood, but now is hitting with our children as well, is growing dramatically. In 2004, actually it was, there was a study done where it was predicted that there would be around 250 million diabetics on the planet by the year 2010. So in 2004, it was predicted by 2010, we'd have about 250 million diabetics. Well, actually what happened was a couple of years before that, we hit 366 million. We're now at about 400 million diabetics, and we're heading for 700 million diabetics within 5 or 6 years. So there's been this huge explosion of diabetes, and alongside that huge explosion of obesity. And we have to start to look at, well, what are these things that are causing it? And we know what's causing it. It is our obesogenic environment. That is what's causing the problem. We live in a land that literally is fat promoting, is weight promoting, and is full of the kind of rubbish that really clogs us up and makes us put on weight. So we actually have to change and intervene in our own life. You know, step number one, if you're wanting to get well and wanting to lose weight, is you must change your environment. If you continue to do what you've been doing and you're carrying a lot of weight, you will continue to carry that weight. So step number one is changing your environment. Step number two is intervening in your own life. So you have to go, okay, I'm going to make a change and decide what that change is and then follow through on that change. And of course, we can help you do that as well. We have programs here at the Exceptional Health Company that are phenomenal for transforming your weight and how much you carry, and phenomenal at lowering and changing your risk of diabetes, whether it's pre-diabetes or fully blown diabetes, or whether you're just wanting to prevent it happening in the first place. So we have an enormous collection of programs that can really, really help in that area. So there's been this huge growth in obesity, a huge growth in diabetes, which is literally taking years off people's lives. It's a real problem, it's a real concern, and if it was anything else, as I said, we would be running around in a lather about it, but it creeps slowly. So what we need to do is change and intervene. We need to be prepared, we have to change our environments, and we have to start looking at how much we're eating and what we're doing. Because if we can learn from the centenarians, we notice they live lives very differently to how we do. They don't have the obesity problems, the diabetes problems. They're eating a very different diet based around very, very different foods. So what they're eating is a plant-based, whole food diet. They're drinking a different level of alcohol. They move most of the day. And by the way, one of those myths that I'd like to bust right now about obesity and diabetes and exercise, it's not all about exercise as well, at all. It's not all about exercise. A lot of people think they have to train like an elite athlete to lose all the weight. You actually don't, because it's what you're eating that's putting the weight on. You can actually move normally throughout your day and lose weight gently in a good, sustained way if you're doing it cleverly. So what I recommend you do, if you're in a situation where you feel like you're obese, or you've been diagnosed as obese, or you're overweight, or you're just wanting to lose some weight, come and talk to us, talk to the experts here at the Exceptional Health Company, come on board with us, do my 20 Golden Weeks or the Life Plan, work with our experts here because we can help you lose that weight for good.